Hello, and welcome to the Post COVID-19 Interdisciplinary Clinical Care Network Education Series. This video is the first of a series on mental health and COVID-19. As always, please remember that these educational modules do not replace a visit with your doctor or other healthcare provider. Remember to take your time watching these modules. Aim to limit your screen time by watching just a little bit at a time. You are welcome to pause or to look at any videos as many times as you wish or need. Before we begin, we'd like to acknowledge that PHSA provides services to a diverse population, including First Nations, Inuit, and Métis peoples living in various settings and communities across BC. As a provincial network, we operate on the unceded traditional and ancestral lands of many Indigenous peoples. We wish to acknowledge with respect and gratitude all of the Indigenous nations, Inuit, and Métis communities with whom we live, work, and provide care. Today we will be discussing the possible effects of COVID-19 on your mental health. Living life in the midst of a pandemic or living through a COVID-19 illness can affect emotional and mental well-being. The effects can include worry, anxiety, traumatic stress and PTSD, low mood and depressive thinking, stigma and discrimination, and isolation. Recovery from COVID-19 is a silent journey for a lot of people. Symptoms are often invisible and not well understood by those around you. This can make it difficult to access support. No, you are not alone. Many people report these effects after they have lived with COVID-19. The good news is there is help available. It does get better. Today we are going to be focusing on stress, worry, and anxiety. We will learn how to recognize traumatic stress and its effects, how to cope with the uncertainty, stress, and anxiety that comes with COVID-19, some tools and techniques to help with coping, when and where to get help with mental health and general well-being, and we will provide some helpful resources to support you in your recovery. To begin, let's take a moment to reflect on the effects that COVID-19 has had on your mental health. First, take a piece of paper and on it draw a circle. Inside the circle, list all of the ways your mental health and well-being has been affected. How have you been feeling? What, if any, mental health symptoms have you been noticing? There are no right or wrong answers. This exercise can help you to tune into how you're doing right now. Tuning in and understanding how you are doing is the first step needed to take care of your health. You may notice that your stress, worry, and anxiety have increased, or your mental health has been affected in other ways. Stress, worry, and anxiety are some hallmarks of living with COVID-19. This mental health series will help you to understand and care for your mental health. Having a health condition or being hospitalized due to a health crisis can lead to worrying thoughts, particularly about the future. This can also lead to a great deal of worry and stress for the people who care for you, your family, and your friends. We may worry more about having COVID-19 because it is a new disease. For other illnesses like heart disease and diabetes, we have a better grasp of what we need to do to cope and to manage. It is important to recognize that too much stress, worry, and anxiety can really have a negative effect on so many areas of our lives, such as daily activities like sleeping, concentrating at work or school, or interacting with our loved ones. When we think about COVID-19, we need to also think about the stress that can come along with it. According to the Center for Addiction and Mental Health, traumatic stress is a natural, emotional response to frightening or dangerous experiences that involve actual or threatened serious harm to oneself or others. These types of experiences are called traumatic. This is a normal response to any traumatic event, such as the global pandemic, a personal tragedy such as harm or death of a loved one, or living through a natural disaster such as a fire or flood. These events and the stress they cause can overwhelm the nervous system and result in intense emotional and physical reactions. The symptoms of traumatic stress may be emotional. You may have experienced shock, fear, and disbelief in response to the situation. You might stop connecting to yourself and the world around you, or lose interest in the activities you once enjoyed. You might also begin to avoid family or friends. Some people experience sadness or grief, especially if there have been life changing consequences or losses for you or others close to you. Feeling vulnerable or helpless over the situation is common and for some can result in or worsen anxiety or depression. Trying to make sense of the experience can lead to feeling guilt or shame, perhaps feeling you could have in some way done something to change or prevent the outcome. Feeling overwhelmed can also lead to feeling angry or irritable with ourselves or others. In addition to emotional symptoms, the physical symptoms of a traumatic stress can also be very distressing and can include feeling dizzy or faint, having a fast heartbeat, or feeling short of breath and sweaty, or a whole number of other physical sensations such as stomachache, headache, and muscle tension. Both emotional and physical symptoms can disrupt sleep patterns and make it hard to concentrate and focus, making many tasks, especially those that require us to multitask or solve problems, more difficult. It is common to experience changes in thoughts and emotions, such as having unwanted negative thoughts or to worry that something bad will happen again to you or a loved one. To perhaps feel that we need to be hypervigilant or constantly on guard for a threat to our safety. Other people may actually re experience the traumatic event through intrusive, disturbing thoughts and memories, nightmares, or feeling like it is in fact happening again. This can lead to avoiding the activity or places that remind you of the traumatic experience. Some people may avoid going to the hospital after being hospitalized with COVID-19 or other settings that are associated with the illness. Without adequate support or ways of coping, some people are at risk of beginning or increasing substance use as a way of dealing with their stress. All of these experiences can increase risk for thoughts of suicide. People often notice their emotional and physical symptoms begin to improve after the initial crisis is over and life begins to return to normal. This recovery process can look different for everyone. For some, feeling less distressed, feeling better may take days, for others, weeks. It is especially important to know if distressing symptoms worsen or continue for a month or more after a traumatic event, or if these symptoms appear months or years later, you may actually be experiencing post-traumatic stress disorder, more commonly known as PTSD. We now know that many people recovering from COVID-19 also struggle with PTSD. If this sounds like you, talk to your doctor as soon as possible. Some stress, anxiety, and fear is a completely normal and healthy part of our makeup. All can help us in some way, perhaps to challenge us personally or professionally and help us to grow, or to avoid dangerous situations and serious harm or injury. COVID-19 is an unknown, and we are learning more about it every day. This knowledge has helped to respond effectively to minimize the harmful effects of COVID-19. One very important task in recovery from COVID-19 is to be mindful that these feelings do not get in the way of your daily life and well-being. So, what can we do? Living through a crisis of any sort, including a COVID-19 pandemic or getting sick with COVID-19, comes with a great deal of uncertainty. Uncertainty is very hard to sit with. Most of us are planners. We want to know what will happen and when it will happen so we can mentally and physically prepare. But that is impossible to do with many health conditions, including during recovery from COVID-19. The hardest thing to do is to sit with that uncertainty. Ask yourself, is there something I can do about this today, this week, or this month? If the answer is no, then your task is to let it go and refocus on the present, to focus on what you can do something about. Let's look at some ways to help with coping. First, set limits for media consumption. Tune into the news, but also create boundaries and unplug as needed. You might give yourself only 20 minutes per day to read or watch the news. It is also so very important to seek your information from trustworthy sources such as the World Health Organization, Health Canada, the BC Centre for Disease Control, or your local health authority and trusted medical professional. Consider taking a break from social media sites that are sources of misinformation or trigger distress. Seek the support you need from both informal and formal sources. This can be from family and friends, or your family doctor, a therapist, community support group, or psychiatrist. Identify and challenge your worrisome thoughts and anxiety. Some ways to do this are by setting aside or scheduling a specific time during the day to worry and consider solutions to your problems. Set a reasonable time limit for this activity and commit to moving on as best you can for the rest of the day. Another strategy is to get other points of view on your situation. Perhaps ask a friend or family member what they might do or how they view the situation. This can help to consider other, more helpful ways of thinking. Keep busy with other things and gradually return to normal activities. As a way of relieving stress, think about practicing relaxation or meditation and try to do activities you enjoy, even if you must alter the method or length of time involved. Staying in the present helps us to focus our energy and attention where we need it, on the people and tasks before us, rather than the things we have no control over. Try to use your energy wisely. As much as possible, simplify tasks and use the energy for activities that help you to feel better. There are many mobile apps that can help with this practice. Consider downloading and using an app on your phone where and when you need it. Some helpful apps to take a look at are Calm, Headspace, and Mindshift, or you might try some Yoga with Adriene, which is available on YouTube. Continue any faith or spiritual practices that are meaningful for you and your family. And always remember to take care of your body. Eat well, avoid alcohol and drugs, get enough rest, and stay active. Finally, consider prescription medication if needed and discuss these options with your doctor. Sometimes problems can seem too big to tackle. Learning to deal with problems or difficult tasks bit by bit can help to make them more manageable. We've included a handout here to help you with this. Learning about and practicing new ways of coping can add to the tools you already have in your toolbox and can also help you to prepare for challenges you might face down the road. Here is a new tool to get you started on your path. It's known as the pause button. Grounding is a technique that helps to deal with difficult emotions by bringing us into the present. It is very useful when feeling overwhelmed, intensely anxious, or angry. There are many different types of grounding exercises, and this is just one of them. The 5-4-3-2-1 skill is one that uses your senses to help you to relax or to get through difficult moments anywhere you are. Take a few minutes right now to practice. Begin by taking a few deep breaths. As you are breathing, describe 5 things you see in the room or nearby. Do so out loud if you can, but this isn't necessary if you're in a quiet space or are not alone. For example, I see the table and chairs. I see the sky. Step 2, name 4 things you can feel. I feel my feet on the floor. I feel the clothes against my skin. Step 3, name 3 things you can hear right now. I hear the clock ticking. I hear the traffic outside. Step 4, name 2 things you can smell right now. I smell a scented candle, the freshly mowed grass. Or you can name 2 smells you like or find pleasant. And step 5, name 1 thing you can taste. I taste my gum, a mint, my coffee. Or instead, name 1 good thing about yourself or your day. When you have finished the exercise, take a few seconds to note how you are feeling. You should feel calmer by the time you have finished. If needed, you can repeat the steps more than once. Try this technique to help with anxiety, getting to sleep, or for general relaxation. Remember, you are not alone. If you feel alone or you are experiencing a high level of anxiety that is interfering with your daily life, reach out and talk to someone. This may feel hard to be vulnerable and to ask for help. That is a normal part of healing. Just like a muscle you haven't used in a while, it will get easier. Talk to your family doctor or another health professional. Visit this online resource developed by the province of British Columbia for more information. If you are feeling that life is not worth living, or you are self-harming or considering suicide, get help immediately. Call your doctor, go to the emergency department, or call 911. Know there are also a number of crisis lines available 24 hours a day, 7 days a week. All support lines are toll-free and accessible to anyone. Here are 3 options listed below. The staff on these lines will listen and will not judge you. They will offer guidance and resources to help you through your crisis. Some final thoughts for today. We have talked about a lot. It is most important to remember you are resilient. Don't underestimate your ability to cope, even if circumstances feel overwhelming. Remind yourself, when you have faced tough things in the past, how did you get through the difficulty? Who did you lean on, and what was helpful to you? Be kind to yourself. Learning and trying new coping skills takes time. If you miss a day, it is okay. You are still moving forward and can always begin again. So now is the time to reflect and to think about next steps. Which of the strategies we discussed today will you try? Once you've chosen, it helps to write it down. Put it up somewhere where you can see it every day. Make a promise to yourself to do it for even 1 hour per week. There is no right way to do this. Just start and take one step at a time. We would like to leave you with this short meditation exercise that you can do anywhere. When you are ready, take some time to click the link and enjoy. Thank you for joining us today and for investing in your mental health and well-being. Please take some time when you are rested to explore and consider these other resources.